Hi, it's Dr. Schallenberger again. I'm back with part 3 of this video series entitled Disease is Optional, You Can Opt Out. In this one, I'm going to talk specifically about thyroid function and why it is so absolutely critical to mitochondrial function. And a part of that is to discuss and explain to you why it is that the thyroid blood tests that I was trained to use and all doctors were trained to use to determine thyroid function is pretty much useless for this purpose, and how you can learn whether or not you have adequate thyroid function without having to rely on these useless tests. So let's get going. These are the kinds of things that we're going to discuss in this part. Number one is the history of thyroid testing and resting metabolic rate, known as RMR. We're going to also talk about why thyroid function is so critical to mitochondrial function. We're going to talk about how RMR is determined. And we're going to talk about the factors that determine RMR. Basically, we're going to look at lean body mass, sleep, and thyroid function. All three of those factors play a role in what your RMR is. With bioenergy testing, you can measure your RMR quite accurately. And if it's low, that only leaves you three choices. Either one, you have poor lean body mass, or two, and that can be determined, by the way, by another part of the bioenergy testing process, which has to do with body composition analysis. Or two, you don't have a healthy sleep schedule. Well, we can just determine that by history and perhaps an overnight oximetry. And if both of those are okay, you only have one other choice left, and that's low thyroid function. This is the most accurate way to diagnose low thyroid function. Number 5, if your RMR is low and your lean body mass and sleep are okay, you're going to need thyroid hormone replacement. Probably, from what I've learned in 20 some odd years of doing this test, is the odds are probably 9 out of 10, if you're over the age of 50, that your thyroid is not operating optimally. It just kind of goes with age, and you're going to need to take something to help bring that up to par, or you're just not going to be able to have optimal optimal mitochondrial function. Part of what thyroid does, by the way, and we'll learn a little bit about this, is help your body to process and burn fat. So in part of the bioenergy testing system is we can determine the ability for your body to properly burn and metabolize fat. And if it's not there, if you're not doing that very well, that's pretty much of a key to tell us that you need some thyroid hormone replacement. We'll learn a little bit about how fat metabolism can be determined. Interestingly enough, we can use the same data from bioenergy testing to tell us how efficiently you're burning fat. And finally, what we do is, if your RMR is low and your lean body mass and your sleep schedule is pretty good, we're going to give you enough thyroid to bring your RMR to at least 90% of what would be typical for a young person. Basically, everything gets defaulted to the age of 40. So we'll bring your RMR up to the point that's typical for a person your height and weight and your sex who's 40 years old, no matter what age you are. Because no matter what age you are, I want you to have youthful thyroid function. That is the key to optimal mitochondrial function. Okay, so let's start off with the history of thyroid testing and resting metabolic rate. You see, back in the early days, and I'm going to go all the way back to the 1800s, the primary way doctors diagnosed low thyroid function, at least from a laboratory perspective, was from cholesterol. Because one of the hallmarks of low thyroid function is an elevated cholesterol. So if you're watching me today and you're saying to yourself, I think my cholesterol is high, one of the reasons very likely could be your thyroid levels are low. But that's not always true, so it's not a perfect test. Around the 1920s, 1930s, doctors started to understand that thyroid controlled resting metabolic rate, or RMR. So they thought, hey, let's measure resting metabolic rate. So they figured out a system to do that. And if the resting metabolic rate was low, they knew that that patient needed thyroid. Well, that was difficult. In order to measure resting metabolic rate back in those days, it required a lot of equipment, very expensive equipment, took a lot of time, took actually a whole office to do that with. And because of these factors, it wasn't readily available every place. Only maybe major cities had that capability of doing that. So mostly doctors at that point just relied on their clinical skills. Basically, they would examine the patient, talk to the patient. If the patient had the signs and the symptoms of low thyroid function, they would say, well, okay, I'll give you a little thyroid, see if your symptoms go away. If their symptoms go away, that's my proof that, in fact, you needed thyroid. None of these ways is absolutely perfect, is it? So in the 1960s, when blood tests came along, they could determine the amount of thyroid hormone in your blood. Doctors thought, oh, this is it. This is great. Now all I got to do is run a quick little blood test. I can see what the blood levels of the thyroid are, and I can know who needs thyroid and who doesn't almost just instantaneously. Only problem with that is it doesn't work. It's inaccurate. Now, what I'm about to tell you is probably going to be hard for you to believe, knowing what I just told you. Resting metabolic rate is controlled by thyroid, okay? These blood tests, in the 60 years that they've been out there, have never actually been correlated to resting metabolic rate. In other words, they got the blood tests. They're assuming they tell you what thyroid function is, but they never tried to correlate it with resting metabolic rate. That's why they're so darn inaccurate. Because about 20 years ago, when I patented this bioenergy testing system I've been telling you about, we can use that to determine resting metabolic rate. And it didn't take me long after I was doing this to see that resting metabolic rates, a lot of my patients were really quite low. And when I did the blood tests were almost always normal. And in fact, I would venture to say that about 90% of the time, when the resting metabolic rate is significantly low, the thyroid blood tests are totally within range, which makes them pretty much useless for this purpose on deciding who needs thyroid replacement and who doesn't. So the key to knowing if you need thyroid replacement is your resting metabolic rate. Just kind of keep that in the back of your head. So, by the way, why is thyroid function so important anyway? Well, we're talking about mitochondria, and thyroid hormone is absolutely critical to mitochondrial function. Critical basically in two primary ways. One, the amount of mitochondria you have in your cells is to a large extent determined by your thyroid function. Thyroid hormones stimulate the mitochondria to regenerate and make more mitochondria. In the absence of an adequate amount of thyroid hormone, your mitochondrial levels go down, 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 and along with that, your energy levels go down, and along with that, you become more likely to develop any disease that you could possibly imagine. So that's thing number one. You need thyroid hormone to actually maintain youthful levels of mitochondria. But that's not all. Thyroid hormone also determines how efficiently the mitochondria you have work. Thyroid hormone is the stimulant to the mitochondria to get to work. Low levels of thyroid hormone, your mitochondria are sitting there, but they're not processing the oxygen nearly as quickly or as efficiently as they could. So these are two reasons why thyroid hormone is absolutely 100% critical to mitochondrial function. One, they pretty much determine how many mitochondria you have, and two, they determine how well those mitochondria work. So that's why it's so critical to know your thyroid function, and do not rely on the blood test to help you with this. Okay, so how can we determine resting metabolic rate? If that's the best way to determine who needs thyroid and who doesn't, and how much thyroid they need, how can you measure that? How is it done? It's ridiculously easy. In the bioenergy testing, remember, I'm measuring how much oxygen you're consuming. So like I told you before, I'll put you on a bicycle and see what your maximum oxygen consumption is. But in order to get resting metabolic rate, I don't do that. I just let you sit very quietly in a chair like I'm sitting here right now. And while you're resting, we call that a resting state, but while you're resting like that, we measure your oxygen consumption while you're not exercising at all. You're just sitting there. That gives me your resting metabolic rate. And if it's low, I know you need thyroid, regardless what the blood tests show. So that's how it's determined. It's very easy. You just sit in a chair for 10 minutes, breathe through the mask, and I can come back and I can tell you right away what your resting metabolic rate is. Now, there's a number of factors that determine resting metabolic rate. Thyroid hormone isn't the only one. It's the most critical one, but it's not the only one. There are two other factors that need to be taken into consideration. One is your lean body mass. So as we get older, unless we're doing something about it, we tend to lose lean body mass. I'm referring to muscle and bone. Your lean body mass are metabolically active and play a significant role in resting metabolic rate. So if you have lost a significant amount of lean body mass, that can lower your resting metabolic rate. Now that can be determined by body composition analysis, which is part of the bioenergy testing procedure. We do measure your body composition. So if your lean body mass is good, I'm thinking more on your thyroid, okay? The other thing that can lower your resting metabolic rate is poor sleep. If you're getting inadequate sleep, either by choice, you only get 4 hours of sleep a night, or not by choice, you have sleep apnea or some kind of abnormal sleep condition where you're not getting optimal sleep. We can discover that with other tests like oximetries and also just by talking to you and getting a pretty good idea. Most people know when they're not getting enough sleep. So as long as your lean body mass is okay and your sleep is okay, if your RMR is low, bingo, it's thyroid. And what we want to do at that point is give you enough thyroid to bring your RMR back to what would be considered a youthful level. Now, thyroid hormone is critical, and we're going to talk about this in the next part, but thyroid hormone is critical for fat metabolism. So another way to determine if thyroid hormone is a problem for you, or an inadequate amount of thyroid hormone is a problem, is to look at your fat metabolism. And in the next part, I'll discuss how that's done, but we can measure your degree of fat metabolism. If you are not metabolizing fat sufficiently, you've got a thyroid problem. Cholesterol is a fat, for example, so you can kind of remember it that way. But we can test your fat metabolism. If that's decreased, if your RMR is decreased, we don't need any more information than that to know that your thyroid needs some help. So we're basically going to give you enough thyroid in that case to bring you back to a youthful resting metabolic rate. And here's the thing, when we do that, your overall mitochondrial function can improve, sometimes very dramatically. It's quite common for me to see somebody with, say, a decreased mitochondrial function in the order of, say, 80% of optimal, and they have a decreased RMR, and I bring their thyroid up to a healthy RMR, and bingo, their mitochondrial function goes from 80% to 105% just from that one intervention. So it's incredibly important to know, and just remember, you're not going to determine this from thyroid blood tests. They will totally miss this. Only way you're going to determine this is by analyzing and measuring your resting metabolic rate and then treating that appropriately with thyroid. So that's the end of part 3. In the next part, part 4, I'm going to talk to you about the critical importance that diet plays in all this and how you can determine what's the best diet for your particular mitochondrial genetics. So we'll see you then.